Hello and welcome to Health Professional Radio. I'm your host, Patrick Reyes. Now, given that heart and cardiovascular disease are amongst Australia's largest health issues, we've decided to invite Dr. Jason Kaplan onto the show. He is an Australian-trained adult cardiologist with a subspecialty training in cardiac imaging, and he is currently the clinical lead of cardiovascular and respiratory medicine at Macquarie University, and is a clinical lecturer in medicine and cardiology in the Faculty of Medicine and Health Sciences, teaching undergraduate and postgraduate students. Welcome to the show, Jason.
Thank you very much for having me.
Oh, thank you. And now, can you tell us the rate of heart attacks in Australia?
Look, every 10 minutes, one person in Australia has a heart attack, and this is data from the Heart Foundation, with heart disease probably being the number one killer in Australia and also the number one killer of people worldwide. What's also really interesting is that most people think it's a disease purely of men, but actually women who after the age of 55 or 60, their risk for heart attacks also increases significantly. So it affects both sexes, equally after the age of 60 as well.
And why is cardiovascular disease so prevalent in Australia?
Look, I think the majority of it is because of our lifestyle change. We are becoming more sedentary. In fact, sitting down is almost the new smoking, and we're a lot of us sit at our desks. We don't move a lot. Our way of eating has become slightly more Americanized, that, there are strip malls with fast food outlets, and where I practice in the western suburbs of Sydney, I see a McDonald's, a Pizza Hut, a Kentucky Fried Chicken all in a row. And this is where, people eat this really, really bad food and increases the risk of heart disease. Also, we're not walking, we're not spending enough time outdoors. Children start from very early, playing video games instead of going out and exercising. So our rate of heart disease is increasing because of lifestyle factors, and it's lifestyle factors that will be able to change and reduce our risk of getting heart disease in the future.
Speaking of lifestyle choices, what lifestyle choices can people make to stop heart disease without drugs or medication?
So this is a fascinating area in cardiology where intuitively we've known that making positive lifestyle choices will make a big difference to your outcome, but we never really had the data or the large studies to show this. And to make any meaningful sense of information in cardiovascular trials, usually you need about 10,000 patients. And traditionally pharmaceutical companies have done large trials to show the effects of drugs and pharmaceuticals, but it was very difficult to show this in large clinical trials for lifestyle intervention. But that has really changed over the last few years, and there was this amazing study published in 2013 in one of the biggest medical journals and most popular in the world called the New England Journal of Medicine, based out of Boston, and it was called the PREDIMED study. And the PREDIMED study showed the effects of a Mediterranean-style diet at reducing heart attacks and strokes over quite a few years. And the amazing thing they found was, compared to a traditional way of eating, people eating a Mediterranean-style diet, which was lots of whole foods, lots of nuts, lots of fresh fruit and vegetables, and interestingly, a large amount of extra virgin olive oil incorporated in their day-to-day cooking and eating habits, reduced the risk of having a heart attack or stroke by 40%. Now, to give you an idea about how powerful that is, that's like taking the most popular cholesterol drug called atorvastatin. That's like taking 20 milligrams of atorvastatin, the effect of lifestyle, which is pretty amazing. Then if you add to that the compound effects of doing regular exercise, people just need to get moving. I tell my patients that you should get one of those fitness trackers on the wrist and make sure you're doing at least 10,000 steps a day. And if you're getting to around 10,000 steps a day, you have a very, very good idea that you're moving and you're getting enough movement that you need to reduce your cardiovascular risk. And there's always lots about what type of exercise to do. For me, and the advice I give my patients is you just have to get moving and make sure that your heart is, your heart's beating to a level where it makes it a little bit difficult to talk comfortably, and you're doing that quite a few times a week. And you just got to do something that you enjoy, because that's something you'll that's something that you'll do more and more often. So lifestyle choices are becoming paramount, and the way that people can do that on a consistent basis is by making choices in terms of the diet, the food that they eat, and exercise.
Now, is heart disease hereditary?
Heart disease is hereditary, and I can't overestimate the effects of having a first-degree family member with heart disease has on your cardiovascular risk. And so for people that don't know their family history, it's important to speak to your relatives and find out exactly what sort of heart condition that they have. And the majority of heart diseases we see in Australia relates to coronary artery disease. And that is a buildup of plaque in people's coronary arteries, which are the arteries that supply the blood supply to the heart. And that definitely has a hereditary component. The cause of that is often very high cholesterol and high levels of bad cholesterol, which is often hereditary as well. And often high blood pressure, which is also a component, is affected by hereditary components. What we've now known is that despite having a hereditary predisposition to heart disease, if people make simple lifestyle changes such as having a healthy weight, doing regular exercise, having a normal blood pressure, and choosing a more Mediterranean style diet, and also interestingly having lower levels of stress, you can reduce your underlying genetic risk for heart disease by over 50%. And this was from a very powerful study that was published just a few months ago at the American Heart Association in New Orleans. So in a way, your genes, your genetic makeup loads the gun, but it's the environment that pulls the trigger, and we really can change what our genetic predisposition to heart disease.
Now, you did mention high blood pressure. What does it mean to have high blood pressure, and what can it do to your body?
So high blood pressure, commonly is when the pressure in our arteries that supply blood to all of our organs in our body is elevated above 140, which is the top number, which is the systolic number, or 90, which is a diastolic number. And systole and diastole are the two phases in which the heart pumps. Now, blood pressure is one of these very insidious diseases because it doesn't really cause any symptoms until you start to see the end effects of blood pressure. And when I talk to patients about having high blood pressure, I liken it like the waves hitting rocks on the ocean coast. That for many years they're subjected to these waves of high blood pressure on their arteries, and it's only after many years, just like you see erosion of the rocks, you start to see changes in your blood vessels. So high blood pressure has effects on the blood vessels by making them harder and stiffer, which increases your risk of stroke. It has the same effect on your heart muscle. So as our heart has to pump out against the higher blood pressure, the heart muscle becomes stiffer, and in actual fact is one of the main causes of heart failure going forward. High blood pressure is also the major epidemiological cause of a disease that causes strokes, which is called atrial fibrillation, which is an irregular heartbeat, and it also can affect our kidneys as well. So it's really important to get your blood pressure checked and also to get on top of it early. And because you don't feel the effects, you don't actually start to see the effects of high blood pressure on your body until a lot of the damage has been done.
And what are some of the signs and symptoms of high blood pressure, and how can we control it?
So a lot of people will feel that if the blood pressure is very high, they often feel a pulsation in their head or their neck. Some people might feel that they might get headaches. Blood pressure can affect the eyes as well, and the eyes are a really interesting gateway into our blood vessels. And for anyone who's interested, they should really they can see an optometrist, an ophthalmologist, and get them to take a picture in the back of the eye, because you can really see the changes of high blood pressure, and often it's called silver wiring. And using the eyes, you can actually see what's a marker as what's happening to the blood vessels. Also in my clinical practice, I use something something called pulse wave analysis, which is measuring the stiffness of people's arteries. And this measures something called pre-hypertension. So people who have high blood pressure have very stiff arteries, and almost certainly they'll go on to develop high blood pressure down the line. Now, over a quarter of all men over the age of 50 in Australia are on high blood pressure medication. There are a lot of lifestyle things we can do to lower high blood pressure. One of the most important things is having a diet in high fruit and vegetables, to lower your salt intake, to regular exercise, alcohol restriction, even things like meditation and exercises to reduce our stress and anxiety are very helpful. And in some cases, supplements can be very helpful as well. There's been some recent studies recently published about the effects of aged garlic extract on blood pressure, and there's actually some very promising results when aged garlic is used in people that do not have very high blood pressure, or as an adjunct to medication to try to limit the amount of drugs people may use to lower their blood pressure, and can sometimes lower high blood pressure by 10 to 15 millimeters of mercury, which is often an effect of a single drug. So it can be very effective.
Now, before we get more into aged garlic extract, what are some common kitchen ingredients for a healthy heart?
So I always tell my patients that it's better from the plate than the bottle, and it's not often that I tell patients I would recommend taking, too many supplements, because I think the best nutrition comes from the food that we eat. I tell all patients I think it's really important to have quite a few servings of fatty fish, so they get their quantity of omega-3 fish oils, so salmon, mackerel, sardines, plenty of fish, like three times a week. If you're not getting it, I would think about taking a fish oil supplement from a good quality supplement. I think extra virgin olive oil used salads and on raw foods is a great supplement to have. Diet that's high in fruit and vegetables. The other really important thing to include is fiber. So fiber is great at lowering our cholesterol, and it's one of the most effective ways we can lower our cholesterol by simple dietary means. Things like psyllium husks, a very helpful beta-glucan that's in oats, or plenty of fiber-containing vegetables is a great way to lower cholesterol over the long term.
All right, so yeah, you did mention aged garlic extract. Can you tell us more about the benefits of it?
So what's really interesting is when I spoke earlier about the Mediterranean-style diet, what we're starting to see is that dietary eating patterns, instead of single foods, make the biggest difference in people's outcomes. And why the Mediterranean-style diet has done well for all these people who live around the Mediterranean basin is that included foods like garlic as part of their regular eating patterns for hundreds, if not thousands of years. Now, aged garlic extract is a special form of garlic to optimize the beneficial effects of garlic without some of the smell or the effect on people's breath, and also is a very standardized form of the compound, and has been shown in quite a few clinical studies to lower blood pressure, and also, really interestingly, to slow the effect of coronary artery calcification. Now, coronary artery calcification is the buildup of plaque in people's coronary arteries, which is what we call coronary artery disease or atherosclerosis. There has been some very early studies that show that aged garlic extract can slow the progression of this in certain people, and it's useful as an adjunct to regular recommended treatment programs in people with coronary artery disease.
Now, for our final question, what is the biggest misconception about heart disease that you would like to clear up?
Well, I think that from the latest study that I mentioned from the American Heart Association, that despite your genetics, we have the power to change our risk of developing heart disease going forward by making positive lifestyle changes. And we must never think that we are a product of our genes. And lifestyle change, even though people may not see it as powerful as drugs, and it's often a lot harder to do than simply popping a pill, but the effects of making lifestyle choices far outweigh and are more beneficial on people's overall health than just purely relying on medication to make those changes. So I think one of the misconceptions is that people often think, well, I've tried lifestyle, it's not going to make a big difference. But all the data now suggests that how we live our life, and that food and the eating patterns that we use and the exercise choices that we make a major difference to our cardiovascular outcomes, reducing our risk of stroke, reducing the chance of high blood pressure. And in all the major guidelines, it still remains the cornerstone of cardiovascular disease prevention. So I think people must not underestimate the powerful effects that lifestyle can make at reducing heart disease.
All right. Well, it's been a real pleasure having you on the show, Jason.
Thank you very much for having me. I appreciate it.
Yeah, thank you. Now, you've been listening to Health Professional Radio. I'm your host, Patrick Reyes, and we've been in conversation with Dr. Jason Kaplan as we talked about heart and cardiovascular disease, and also what having high blood pressure means for your body and how you can control it. If you've missed our conversation, or if you'd like to listen to this interview again, transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.